Hey, I'm Meredith Laura. I'm the Clerkship Director for Internal Medicine. I'm going to give you a student-centered perspective on how to be an awesome attending for your third-year clerkship student on the wards. This will be a three-part video series, and this first video is all about setting expectations and knowing what your expectations are as a faculty attending on the wards. So let's face it, we all want to be at least a little bit more like Kimberly Manning when it comes to being a ward attending. Over the last 5 years in this clerkship director position, I have asked countless students why Dr. Manning is such an amazing attending. In addition to many incredible qualities, the first thing they mention is that on day one, Kimberly Manning sits down with them and tells them exactly how they can be an exceptional student in her eyes and how to meet those goals. It propels the student to work hard towards specific, concrete, and clear goals during their time with her. But many of you might not have the experience that Dr. Manning does to know exactly what you should expect of students. So over the next 5 minutes, I'm going to give you a sense of what we expect of our students on the clerkship so that you can align your expectations with ours. The student will feel so much better knowing that what you expect is not conflicting with what we've already told them on the clerkship, and really set them up for success in a really comfortable environment with you and your team. So what should students be doing on the wards? We expect them to be fully immersed in patient care and to do all the activities that an intern would do for their patients, including taking independent histories and exams, presenting patients every single day, writing notes every single day for their patients, and caring between 2 and 4 patients at a time. So they should be picking them up very regularly through the call cycle. What about the when and the where of student expectations? Here's a clerkship calendar with all of the clerkship related student activities. But generally, you can expect them to be with you on your clinical site 6 out of every 7 days. They have to take 1 day off per week, and they are required to take 2 wellness half days over the course of the 6 weeks. If you want to look a little bit more at the nitty-gritty, pause here and take a look at this clerkship schedule. So I've taken you through the nuts and bolts. But what faculty really struggle with is, what is a great student? Or what do doctoring skills look like at the third year clerkship level? I'll show you that goal, but I'm also going to show you the levels of growth working towards that goal through something called the RHYME framework. And that way you can not only set clear expectations for your goal, but also what steps look like when working towards that higher level. All right, so this is the RHYME framework. It's a really concrete, intuitive mental framework that helps you understand the growth from the preclinical years to being a doctor. It's called RHYME because of the 4 stages, which are reporter, interpreter, manager, and educator. Generally, the goal of the clerkship is to become an interpreter, and that's really where students are able to interpret and make conclusions of the data that they've gathered, but that's not where students start. Students spend a significant part of the clerkship working to refine reporter skills. And a reporter level is what they must be proficient in to pass the IM clerkship. This is where they learn their data gathering and data reporting skills. Being able to gather a history and exam at the bedside that's organized and complete, collected appropriately, and focused to the biggest problem at hand instead of including a lot of extraneous data, and then delivering that information along with the data in the chart in an organized, easy to follow, and focused oral presentation. An interpreter is sort of that student who, when they get to the assessment and plan, is able to put things together pretty independently to synthesize an assessment statement that captures the clinical syndrome, to be able to form their own differential diagnosis and to defend it, to identify and prioritize the problems and name them appropriately. And then the other thing that's a little bit more subtle is that when gathering the history and exam and through their oral presentation, you can tell that they're pursuing hypotheses, specifically looking for certain items on the differential. So that is ultimately the goal. That's your A- or A student on the clerkship. Only a few students make it to the manager level, and this is your A+ student. And ultimately we tell students, hey, this is not really your goal, but it's great if you make it here. These are the students that not only can form an assessment, a differential, and a problem list, but it can actually form a diagnostic and treatment plan pretty independently for more than just the most bread and butter cases like heart failure. So that's how we think about student skill expectations using the RHYME framework to map out growth. So you might be thinking, how do you use that information to talk about skills with students and to set them on a clear growth path? Well, I think first of all, just like you were really explicit and concrete about the what and the where and the when of your expectations, just be really concrete about the fact that you'd like to set skill expectations. Tell the student, I want to talk about exactly what skills you want to focus on during our time together. And then instead of telling the student what you want them to do, align your expectations with the students. I'll often ask the student, where do you think you are in the RHYME framework and what do you want to work on? I think they are often the experts on what they need to do, and so that'll be a great starting off point. But sometimes they're a little off in what they're proficient in and what they need to work on. So it's important to lastly loop back in 2 to 3 days with some feedback about those skills and sort of refining those goals for the rest of your time together. All right, so now you have the what, the when, and the where, and the how of what we expect of students on the clerkship. I really hope with this information, you can set expectations with the student on day one in a way that is nuanced and creates sort of an alignment or a collaboration with the student that opens them up to feedback and creates a space where you feel like you're able to tell them exactly how they're doing and how close they are to reaching their goal. All right, so that's part one of expectations. I'll see you in the next video. That's all about feedback.